So let's get started. Thank you so much for joining us today for a webinar on substance use-related stigma. This Lunch and Learn series is hosted by UBC Health and the BC Centre on Substance Use and was developed to provide foundational knowledge on substance use topics with health program instructors and preceptors in mind. My name is Liz Yu, and I'm the partnership manager with UBC Health and the BC Centre on Substance Use. And I'm joining today from the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I just have a few housekeeping notes before we begin. Because this is a Zoom webinar, all the participant videos are off and muted. So if you do have any questions that come up throughout this presentation, please use the Q&A function, and we have time to get to those at the end. We also have a short survey for everyone to complete at the end of the webinar. Your feedback is really important to us as it helps us plan future sessions and also continue to improve this series. So we thank you in advance for taking a minute to complete that after the webinar. It's my pleasure to now welcome our presenter today, Rahim Jan Mohammed. So thank you so much, Rahim, for joining us, and I'll invite you to introduce yourself and to take it away. Thank you.
Thank you so much, Liz. I really appreciate the opportunity to present this afternoon. Hi, everyone. My name is Rahim Jan Mohammed. I'm a BC pharmacy student from 1999. I've also completed my addiction fellowship with the BCCSU, and I'm currently working as a consultant and also as a retail pharmacist. Firstly, I'd like to start with a land acknowledgement. I respectfully acknowledge that I am a humble guest on the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I acknowledge that the ongoing criminalization, institutionalization, and discrimination against people who use drugs disproportionately harms Indigenous peoples. So we'll go to the next slide. So with today's with today's seminar, or what we're doing today, here are some learning objectives. So firstly, we want to describe the impact of stigma on people who use substances. Secondly, the objective is to discuss the role of healthcare providers and educators having in reducing substance use-related stigma. We also want to identify and reflect on ways to reduce substance use-related stigma through curriculum and clinical training. Learners hopefully will come away with the understanding what stigma is and how stigma negatively impacts people who use substances. And what can you do as an individual or healthcare provider or an educator to reduce stigma and therefore provide better healthcare? So move to the next slide. We're going to start with this chart. As you can see, you have the X and Y axis. So on each axis, if you can clearly read, you have the average number of, of deaths per day. And then you also have the year of death. Looking at this, like, why are we talking about this? As you can see, the numbers have grown year over year. In 2016, BC's provincial health officer declared a public health emergency as a result of the emerging opioid overdose crisis in the province. As of last year, in 2022, BC had an average of 6.3 deaths per day due to the toxic drug supply. Like, you got to listen to that. Due to the toxic drug supply, 6.3 people died per day. Stigma is identified as one of the ongoing factors that has resulted in the lack of impactful response. It has also been implicated in why many people are dying alone when using substances. Stigma against people who use drugs results in discrimination, and impacts their health, and it also contributes to overdoses. Reducing stigma around substance use is one major intervention. We have to address the toxic drug. We have to address the toxic drug crisis, and at a multi-system level. Go to the next slide here. So when reviewing overdose epidemiology, as you can see, in BC in 2022, 84% of illicit drug toxicity deaths occurred inside residences. Despite common misconception, majority of overdoses are people who are experiencing homelessness. So despite that, 79% of fatal overdoses were among men. And the age range is between 30 and 59, which was most impacted. In Fraser Health, analysis has shown most overdose deaths are occurring in private residences among men 19 to 59 years of age, and the majority of these men work in the trades. This speaks to shame and stigma related to men who use substances. Stigma which prevents them from seeking care and instead risk their lives by using drugs alone. If you review the chart, you can really get a lot of information here. And that's in 2022 last year. We'll see what happens next year when we get the 2023 results. We can move on to the next slide. So looking at this cartoon, we're looking at what is stigma. Stigma refers to the negative attitudes about a group of people and substance use disorders that are highly stigmatized. It can lead to feelings of guilt and shame. People are hiding their substance use from their family and their friends and using substances in risky environments. It can be a barrier to accessing health services or disclosing substance use when seeking help. Stigma is also perpetuated by drug laws, which criminalize individuals because of substances they use. People who experience multiple forms of stigma experience greater harms. For some, what may appear to be problematic or chaotic substance use can be a result of surviving trauma, poverty, criminalization, colonization, or racialization. Next slide, please. So let's take a look at this quote. This is from a study in New York City, and I'll just read it out to everybody here. You know, people tend to look at you in a certain way. Some people just stop talking to you. Some people will just ignore you. And some people will just step away from you. Well, it's happened with nurses. One time I was sick, and by me just being sick, they stopped attending to me. This is stigma. It's what people say, don't say, the care they do or they don't provide, and it impacts the internal narrative of that person. So this was from New York City, as I told you earlier, and this is a very strong statement of the perceptions of the healthcare system and how it affects it. Many of the participants felt victimized, judged, ignored in a time when they looked towards medical professionals for help. So this was a quote from a man that went to a hospital with opioid withdrawal and whose complaints were dismissed as drug-seeking behavior. So it's very strong, very important. Next slide, please, Liz. So I'll take a moment here and go over this really quickly here for everybody. So people experience multiple forms of stigma and discriminations are more likely to experience greater harms. So it doesn't occur in a vacuum. Stigma doesn't occur in a vacuum. People who experience multiple forms of stigma have greater harms. So when you're looking at the overlay here, on the outside, you see the macro, the structural. Then you get to the interpersonal, the meso layer. Then you get to the intrapersonal, the micro layer. Consider, for example, the intersection of substance use stigma and social marginalization and the oppression of poverty, which then results in a compounding negative health outcome. As you can see, the health condition in the middle and every layer that layers over that. And you can see that crossover with each individual section: gender, religion, disability, sexuality, age, comorbidities, and poverty. So really important to kind of review this and talk to your students about this as well. We'll go to the next slide. So as we review the misconceptions that contribute to stigma, we'll go over substance use occurs across a spectrum from beneficial and non-problematic to substance use disorder. Substance use disorder is a health condition, not a moral one. Addiction is not a choice. Tough love is not helpful. There are many misconceptions about substance use and addiction that contribute to stigma, often perpetuated by negative stereotypes in the media. As educators, health professionals, it is important to be aware of these and educate others to disrupt stigma. Number one, not everyone who uses substances will develop a substance use disorder. Secondly, substance use disorder is a complex health condition. It needs to be treated as one. Also, addiction is not a choice, as I mentioned earlier. There are many reasons why people choose to use drugs, including trauma, injury, or mental health challenges. The social determinants of health can impact addiction and substance use-related issues. People who use drugs and have a substance use disorder are deserving of kindness, compassion, as tough love can push them further away. So start giving them kindness and compassion and really, really bring that home for your students. And as educators, we want to make sure that we continue to talk about stigma and talk about the misconceptions. Next slide. So with substance use stigma, silences people, resulting in guilt and shame towards asking for help or accessing services. This is a barrier. It's a major barrier in accessing healthcare. It leads to substandard care or even to people being denied services. Denied services due to policies and actions of people. It prevents constructive dialogue about seeking help. We know that stigma contributes to the overdose crisis and puts patients at greater risk. These are the 4 things that I want you to keep in mind, because when you have the first one, making it difficult for people to ask for help and resulting them in hiding their drug use from their family and friends and using substances in risky environments, especially if they're alone, think about what might happen. Also, substance use stigma does create barrier to accessing treatment. It can lead to, and it does lead to, substandard or denial of care. Healthcare providers might treat patients or clients with substance use disorders differently due to stigma. Stigmatizing views and influences clinical practice and leads to disrespectful and potentially hurtful treatment in the healthcare setting. Example would be a misdiagnosis. Discouraging people who use drugs from seeking support from healthcare providers. This is what ends up happening. People will not look to get support due to the stigma. It also creates an environment where people are judged for their addiction and they're accused of being responsible for their own illness. Again, remember this, substance use disorder is a health condition and needs to be treated like one. Stigmatizing language, shame, and judgment prevents constructive dialogue about seeking help. So these are some major factors that we want to understand about substance use stigma. Next slide, please. So what we're going to see here is a video of stories, stigma, stories of experience from the Unite project, BC Mental Health and Substance Use Services. Liz, whenever you're ready, you can roll the video.
Stigma is when you fail to see the person, you instead see your stereotype of the person and treat them accordingly. The problem with mental health and addiction for me is that the stigma that's associated with it really ties into who you fundamentally are as a person. And when the stigma is so entrenched in our society, it starts to become something that I've believed about myself. So it is still to this day so hard for me to separate societal stigma from personal shame. And I think that's where it gets dangerous, because it makes people feel like they're not deserving of help.
The stigma around that I've faced on a personal level is this inability to trust. And it goes both ways. For me, the stigma in my life is that my actions and my outward reactions to different life circumstances has been a path of using substances to numb the hurt, the pain, the shame, the guilt. By my actions, I've painted myself into this box. And, the stigma of others is remember when you did this? I just don't trust that you'll be able to actually stay clean. For me, it's wearing what feels to be like a dirty coat of mental health and substance abuse. Society has looked at my outward actions in coping with life and has labeled me as somebody that's not trustworthy, that isn't capable of success, that I come with huge risk.
People don't listen to you, they just look at you. I've dealt with stigma on all different levels. Even now, my life has gotten so much better in the last year. I still have people talk down to me when I go into stores, or just are super, super rude to me, even if I'm extremely nice. And it's been like that my whole life. People categorize people just by the way they look without even actually getting to know them.
I remember the stigma I felt as I'm in a mental health crisis, in psychosis, believing the world's out to kill me, and I'm in handcuffs. I don't trust the RCMP. I don't trust the hospital staff. People looking at me, people staring at me, people seeing me in handcuffs, and just assuming worst case, that I'm a criminal, that I'm someone who is a harm to society. Meanwhile, not knowing who Chris was as a person.
If someone gets cancer, breaks their leg, or has diabetes, people don't blame the person. And yet with things like substance use disorder and mental illness, there is this propensity to look at it from the outside and go, well, you chose that, right? You chose to put that in your body. You choose to not get out of bed, not cook for yourself, not shower, not work. The only way I could really reconcile myself with this was to look at myself as a young girl full of nothing but potential and say, would she ever have wanted this? Would she ever have chosen this for herself? The answer is no.
I remember being a little kid, and unfortunately, though, I thought being bad was cool. And I lived in a complex in Toronto. I thought it was the coolest being around people with weapons and selling drugs. Unfortunately, that fueled my life for the last 29 years. I grew up thinking that stuff was the good thing and the cool thing. And I got into that so young that I never knew any other thing. I put in applications when I was young as a paper boy, pizza shops and fry stands. People just didn't trust me anyways. And they always treated me like I was a little hoodlum, so then I always just acted like one and thought it was cool. Now, almost 30 years later, I've been trying to distance myself from that so much.
I feel like I can't show weakness, because if I show weakness, then I'll be judged for it. Because of all that's happened in my life, that if I'm not crossing every T, dotting every I, being perfect, being flawless, in my perfectionist view of trying to overcome this, I get stuck in this self-defeating trap of being perfect, which is unrealistic. And it would always lead me back out down a path of self-destruction, because I just can't be perfect. I'm a human being. I make mistakes. I mess up.
The biggest myth
that I've seen and experienced is that if you're actively addicted to drugs, that you're not then credible, you're not trustworthy, you're not honest, you're not reliable, you're not anything really. And that's a good chunk of the reason why I was a bad person. I was addicted to drugs for a very long time. And the only way that I could get by is if I was a mean person.
I often hear that it's weak-minded individuals who struggle with addiction, and that's not the case. When I'm in a state of mental crisis or when I'm in a place where I've relapsed, it hurts my heart, and that just fuels continued use, and the snowball effect happens. A myth that I tell myself is that I'm worthless and I'm not worthy to have a future, which is a lie. I'm very capable, I'm very skilled, I'm talented, I'm lovable, I'm a life worth saving.
There's a lot of good people, and they're not just drug addicts. They're not just homeless. They're mothers, daughters, sisters, brothers, fathers, and they all have stories too.
Well, thank you for that video presentation. Looking at it right now, we can go to the reflections slide. So what do we want to do when we look at that video? We should be reflecting upon the experiences shared in that video. And the questions to ask: how did you learn about drugs? Is one. What are your values in relationship to substances like coffee, alcohol, prescribed medication? Research with healthcare providers suggests that stigma can manifest in a subtle, largely unintended way. Stigma can be related to a lack of skills and confidence when working with patients with addiction problems, a lack of awareness of one's own prejudices, and an incomplete understanding of how important healthcare providers are in the process of recovery. The other question to look at is: what are your biases and fears about people who use drugs? Or what biases or fears may the general population have? And how are these biases showing up in your classes, at your clinic? Could ask how they think these could show up, just right now. I'd like to know if you have any questions or anything, put it into the chat box. How could they show up? Just to kind of reiterate, are they showing up? And how are they showing up at your clinic and in your class, and what can be done? People in positions of privilege and power, educators, healthcare providers, can challenge stigma by being proactive, self-reflective, compassionate, and do work to be informed about updates in care. Further to that, being mindful of their biases towards people with different backgrounds, including economic, race, ethnicity, and sexuality, as they intersect with these experiences of stigma. I'll go to the next slide. Thank you. So this slide here is a couple things. We're gonna switch gears here. We're gonna talk about language. The real stigma of substance use disorders. If you look at the picture we have in red, one person was referred to as a substance abuser. The picture in the blue, the other person is referring to this person as having a substance use disorder. Language can have a great impact in increasing or decreasing stigma. The study that was conducted in 2010, participants were asked how they felt about the two people saying actively using drugs and alcohol. The patient referred to as the substance abuser was perceived to be less likely to benefit from treatment and more likely to benefit from punishment, to be socially threatening, and to be blamed for their substance-related difficulties. When you look at this, a little bit of self-reflection and mindfulness has to come into play, and understand that this is a language that we need to change. There was not too much further information given about these individuals, but it was strictly based on one called a substance abuser versus having a substance use disorder. I'll go to the next slide. So where are we at? Where are we at with language? How can you help change the conversation? First thing we're going to look at is using first-person language. An example of that, person who uses substances instead of the word user. Using respectful language will open dialogue and discussion and help disrupt stigma. As educators and health professionals, we need to make sure we recognize where we may be reinforcing stigma, even without realizing it. Here are some tips for non-stigmatizing language. We're going to start. So the first person language means referring to a person before describing his or her behavior or condition. This is important because what it does is it acknowledges that a person's condition is not that person's defining characteristic. As I said earlier, it's person who uses substances instead of user. We'll go to the next slide. The second thing we're going to look at is using language that reflects the medical nature of substance use disorders. The example that it states there is a person with a substance use disorder instead of abuser or junkie. There are a multitude of factors contributing to drug addiction, ranging from personal factors to social, environmental, political. We want to avoid terms that reinforce a belief that the addiction is a failure of morals or personality, and rather a medical issue. When we say person with a substance use disorder, that's using the language that reflects the medical nature of substance use disorder versus abuser or junkie. We'll go to the next slide. The third thing we're looking at in terms of language is using language that promotes recovery and it's strength-based. Healthcare professionals should use language that conveys optimism, supports recovery. It is important to recognize that people have choice and autonomy and are treated with respect and understanding in all encounters. When we say they opted not to and not in agreement with the treatment plan, that makes sense. Versus saying unmotivated or non-compliant, which is always used in pharmacy before. I've used that term myself before I got educated and understood that that term should not be used. Non-compliant behavior or non-compliant is something that doesn't help promoting recovery and is not strength-based. We'll move to the next slide. So the last one, I think I jumped ahead here. So the last one, I missed one back, if you can, sorry. Avoiding slang and idioms. Slang and idioms, they have a negative connotation and a significant level of stigma. The significant level of stigma attached to them. So while they are rarely used in professional literature, they are also important to avoid when speaking to other colleagues or health professionals. The example here is when you're getting a drug test, and I used to always say this, and it's something that was very common, is either your test was dirty or your test was clean. When patients would come into the pharmacy when I was working, I'd be like, oh, you have to go in for your blood work, or you have to go in for your test, or you have to go in for a urine test. And then I would also say, so, did it come back clean? Or was it dirty? Did it come back clean? We have to stick to avoiding these slang and idioms. For example, we have to stick to saying positive or negative versus dirty or clean. These are some tips you want to keep in mind, and we can all change the way we talk starting today. All right, we'll go back to that slide. Thank you. So looking at this slide here, and how do we reframe language from deficits to strength-based from a trauma-informed perspective? The examples you see in this chart in green is what we want to change it from and to. So the deficit perspective, asking a patient, what is wrong? To what has happened? Symptoms to adaptations, disorder to response. Looking through this list, these examples are how to reframe deficits-based language from trauma-informed perspective. The Trauma-Informed Practice Guide was developed on behalf of the BC Provincial Planning Council and is a great resource. So it's a mental health and substance use planning council. The resource is great, so you can always find information there. Getting back to it, when you're looking for attention seeking versus the individual trying to connect in the best way they know how, these are very, very important words. Manipulative. I do recall, like, say, well, they're manipulating things, or in the pharmacy, you're sitting there and, oh, they're trying to manipulate. They might just be having difficulty asking directly what they want. You know, if they're malingering, well, they're just trying to find help. They're trying to feel help in a way that feels safer. We want to make sure that we use the examples and how to reframe that language. We'll move to the next slide. Sorry, looks like I got you going back and forth here. Okay. So paying attention to how language can exacerbate stigma is difficult, but important work. You have to ask yourself, how do I talk about people who use drugs? What impacts do my words have as an educator, healthcare professional, a community member? You want to make sure that you're paying attention to how this language can exacerbate stigma. We are shaped by culture. We are shaped by the laws, media, our relationships with people. We pick language from our peers. As we shift in society and recognize that substance use disorders and substance use are also shaped by culture, society, and other complexities, we need to shift our language to reflect that humanity in all of us. We have to understand that we need to shift our language to reflect that humanity in all of us, including people who use drugs. Important to know, to ask yourself these questions when reviewing things with your students as educators. It is important to not only think about our patients, but for the educators in the audience, the students in your class, and those who you precept, if you're a preceptor for, there's a very high likelihood that in each class, there's someone who is affected by substance use in one way, either personally, through family, through someone their friends. The language we use is very important. It's so important to build a safer, more compassionate environment for our learners, our patients, and also each other. Just want to leave that with you. Like, remember this when you're talking to your students, talking to your family, talking to your friends. It's very important to build that compassion in that environment. So what we're going to do now is we're going to see a video, Resisting Stigma, an interview with Guy from Vancouver Coastal Health. I just want to make sure that everybody pays attention to this video. It's very strong. And he's a peer clinical advisor for BCCSU and the Overdose Emergency Response and Regional Addiction Program at VCH. It's a very powerful story, and it's a testament to influence healthcare professionals it's very important, both negative and positive, in someone's health and recovery. So really, really take some time and review this video and watch it. Thank you.
Remember why you wanted to get into health in the first place? Was it to help others? Was it to improve the quality of people's lives? Then don't ever forget that. People down here, I mean, I even had my friends who were substance users down here, they came up to me and said, dude, you cannot, you have to stop. And you know, they're not talking about them, they're talking about me. It's like, dude, like, please, like, go. From 83 to 93, I was in and out of the area, but from 1993 to 2013, I never left a 2-block radius and really hung out right in front of Insight, before it was Insight. And, you know, went through the first dueling public health emergency, which was the HIV/AIDS crisis in the 90s and also the overdose crisis. I've lost many friends to HIV/AIDS and many friends to overdose. Getting me to go to the hospital for bone infections was like, I had to be nearly dead to get me there. And the reality is even when I got there, I wasn't treated fairly as a person or as an individual. I was treated as a drug-seeking individual. And even with all the pain meds, and this is a true story, while I was in St. Paul's Hospital, and I had the infection in my leg, the doctor prescribed me with, you know, lots of morphine, methadone, breakthroughs, all these, you know, medications, and I continued to use heroin. And he approached me one day in my room and said, we give you all these drugs to, you know, help, and you continue to use heroin. And I said, I'll explain it to you. I said, the drugs that you give me help me with the physical pain, but this drug helps me with the emotional void that's in my soul. And he couldn't understand that. And he discharged me with an active bone infection in my leg, saying that the antibiotics won't work because I won't stop using heroin. And that to me really showed just how egregious some people are and the treatment that substance users get. And it was the main reason of why I never went back, and it was one of the main reasons why CTCT was developed in the downtown east side. And when I did go to CTCT, they said to me, we don't care that you use drugs. All we care about is that you're here every 4 hours to get your antibiotics. If you have drugs and you want to use drugs, you can use them in your room. We just want to save your leg. You believe the lies that you hear everybody say to you in your life. Obviously, the verbal abuse, I think verbal abuse in my life is so crippling as a person, is that even if somebody criticized me in a way, even somebody gave me a compliment, I felt so gross inside. It was so hard for me to accept that. I just didn't believe it, and it's because you were often told that you were a piece of garbage, not only from your childhood, but then you reflect on that from how society treats you. And so I carried that. That is a heavy burden for people to carry. And at that moment, that was somewhat released, where it made me think, like, maybe there's more to it than just what people keep thinking it is. Because inside, I knew what I was going through and the pain. I just didn't trust people to talk to. And so what my suggestion would be to somebody who's new to healthcare or working in healthcare is this. You have to put yourselves in people's shoes, and to understand, even if your life, imagine if you had a job and you had no place to live, and you had no car, and you had no food, but you still had a job, and you're sleeping in a shelter, and now you're hungry and you have to go to work. Like, put yourself in somebody's shoes. Just, you don't have to put yourself exactly in their shoes, but imagine if we eliminated some things out of your life, especially your housing. And then, or if you're going to school, all these things, where if you eliminate or put these challenges in your lives, how would you react to them? How would you respond? You have to go to work. It's like, but you have no housing. You know, or where you're going to get your next meal. What about your belongings? Where are they going to stay? And one of the biggest things that I've often remembered throughout my journey is this, is I've never forgotten how you made me feel. and remember that. I'll always remember the ones that treated me good, but I'll also always remember the ones that didn't. It's funny now when I come down here, people are like, oh, I know you're doing good. And I'm like, how so? And they're like, I've seen you smile more times in 5 minutes than I did the whole 20 years I knew you. And from my friends, that's really how special it is for me, because I broke bread with them for decades, and we shared a lot of our struggles, and just to have them here, for me, it's just it's powerful.
Thank you for that. That was a very powerful video. So we're going to move on to look at ways that health professions, education, the hidden curriculum that perpetuates substance use stigma. So looking at this slide, we want to consider the following ways in which health professions, education, hidden curriculum can perpetuate stigma. So a curriculum that focuses primarily on the negative consequences of substance use without providing a balanced perspective. Stigmatizing language in assessment methods, screening tools, and instructional materials. Lack of cultural humility and safety in that the curricula may not adequately address the cultural and socioeconomic factors that influence substance use patterns, an absence of recovery narratives and resilience, and also an inadequate integration of mental health and substance use neglects the co-occurring nature of these issues and ignores the complexities of substance use as a form of coping. Health education curriculum development, respectful language, teaching styles, and assessments must adopt a more balanced, evidence-based, and empathetic approach. So an empathetic approach that consider the broader social, cultural, psychological factors contributing to substance use and prioritize harm reduction, treatment, and support. We'll move to the next slide. Okay. So what can you do as health professionals, educators? What can you do? Firstly, recognize that substance use disorder is a health issue, not a moral one, not a moral issue. Recognize that the people who use drugs are people who are deserving of care. We want to keep this all in mind as we're doing our education, talking to people, talking to friends, and educating our students, especially during their practicums and first experiences in the public, in communities. We want to learn how to be a safe person to talk with. We want to prioritize trust through compassion and empathy. We want to incorporate trauma-informed care, use respectful language, and advocate for policies that reduce stigma and educate others. We want to be able to understand when we incorporate trauma-informed care, we should be recognizing that many people are experiencing and living in the midst of trauma. We must also try to recognize that the anger or frustration that often stems from life experiences or previous negative encounters with the healthcare system. This is where trauma-informed care is very important. And being a safe person to talk with and prioritizing trust through compassion and empathy, we have to understand to resist assuming, and that word assume is one thing that I've talked to a lot of my students about. We can't assume. We want to resist assuming that people automatically trust you because you're a healthcare provider. We should be aware that showing trust is a good way to build patients' trust in you. And we should also show genuine concern and empathy. Okay, move to the next step, next slide. Okay. So with this slide here, just a little bit more further reflection for people facilitating education. So keep in mind these 4 questions. These are some really important questions. So I'm just going to read them out. While I'm reading them, really reflect on your own practice, your own students, and where you can really take home all the messages from today. So the first one is, do I have any curriculum or teaching points that focus on substance use? Does it include self-reflection on bias and language? Does it include anti-stigma education? Next, do I create opportunities for students to meet folks with lived experiences or to be mentored by people who specialize in this area? What other practicum opportunities are there in my program? Just a quick note on that. There are certain groups and certain advocates for different things that can be done to help support your practical opportunities and for students. So at any moment you need support, BCCSU or UBC Health, they can help you find these opportunities as well. The other question is there a plan in place at placement sites to ensure students are supported? This is very important to support our students through understanding substance use and stigma. And also, am I ready to challenge myself to make the change? I think that takes care of my talk for today. I hope that there are some messages that you can find and take home with you as educators, healthcare professionals, back to your workplace, back to your friends, and back to those that you can make change and understand that how much importance it brings to the healthcare system and supporting our patients with substance use disorders. Some additional training notes here. We have some sites, and again, the slide deck, I believe, can be sent out. I think we'll make sure we have that in place. So additional education and training, and then we have some resources that are there as well. So we can kind of review what we have. At this time, we have a few minutes remaining. I'd like to open it up to any questions that you might have. Again, I'll open up, we can type it in the chat box, or you can raise your hand, I believe, or is it just chat box today, Liz? So we can just see what makes sense.
Yeah, folks can use the Q&A function, and we can review the questions there if there are any.
So if there's any questions, feel free to go ahead with the Q&A function. All right. I don't believe we have any questions. I believe that everything has been, yeah, check. I don't see anything down here.
Oh, I do see a question coming
Oh,
through.
okay, perfect.
So is there stigma education specific to pharmacy practice, as in continuing education for practicing pharmacists? Are you aware of any of that, Raheem?
So I know that there are resources available, whether it's specific within the current curriculum, I couldn't comment on that. However, I do know that there are resources available through BCCSU and through our pharmacy teams out at UBC or in different, online. There's going to be some online modules, I'm sure. However, at this time, I don't have that information available, but we can get back to them if they leave an email, and I'll be able to definitely get some resources out to you if needed.
Great. And we have another question here. So if there's an obvious moment of stigma that occurs during rounds, what is the best way to bring light to that and to positively change the situation versus calling someone out for their language?
Yes, so in a moment, when you're actually treating a patient and you actually have a lot of people there, we don't want to be able to isolating that individual and calling them out in that setting. I would make note of it and then perhaps have that conversation of in later, or actually get some more education to that individual and as a group. Sometimes it can happen. A patient might, feel that this is not the right approach that's being taken, but I believe in rounds it should be mentioned, or if anything, take over the actual conversation and kind of reiterate using our positive language that we had. You have to reiterate in that moment. Sometimes the opportunity is only there in that moment with that patient. I've found that when I've been working as a pharmacist, and I was actually doing some rounds, and I found, okay, everybody has their own way and approach with patients, but I would reiterate to the patient in that moment just to kind of solidify that trust. And then later with that individual, versus calling them out, kind of show a little bit more of an example as to how things should be, and understand that maybe there is some education opportunities there for that person. Because you don't want to be isolating that individual in that moment, because the focus should be on the patient if you're in rounds and actually discussing a case with that patient, and really emphasize that language. And if you were to do that, and if, say, my colleague would be beside me and they would have a different conversation, I would take it upon myself to talk to that patient and just make sure that we bridge that gap that's there.
Yeah, that's great. I really like the idea of modeling the non-stigmatizing language in the moment, and then kind of taking the time separately.
Later on, you can continue with like motivational interviewing and really enhance that opportunity with that patient, and also then bring in that colleague of yours maybe after a debrief as well, so that you can still build that trust, because you don't want to take over. However, you want to be able to make sure that that colleague understands that, well, no, this is what should have occurred, and maybe it was an understanding issue. So again, it's not a blame issue, it's more of just education, understanding, and the more education we have, the more that we'll be able to impact this stigmatizing language that's out there, and they'll learn from it, and then they'll educate. So it just kind of continues to flow that way.
Great. We have a comment from Susan. Hi, Susan. Great presentation. How do you suggest making connections to peer networks in a respectful way?
So peer networks out in the community, I would say that the best I just want to make sure I have the question correct. Are you looking to make a connection with those people that have substance use disorders and trying to talk to them, or what's the peer network? I want to make sure I got that correct.
So I see she said yes. So I believe
Okay.
yeah.
So the best way to approach is to have, if it depends on your setting, because you want to be able to have an opportunity to be able to have conversations. Personally, I've had conversations. However, depending on your setting, I would then, if you have a patient, and just have an open, honest conversation with the patient or their caregiver or their physician, and see, or their counselor, like there's so many groups, or their outreach worker, just to be able to kind of bridge some of those gaps. And maybe before you jump right in and have the conversation with the individual, maybe get a little bit more of an overall understanding of what's happening before you kind of come into it. And there are groups out there, and you can reach out to me as well, and I can connect you to find out exactly how, because I've sat in, and again, I don't want to focus on me here, but I've sat in and I've been called in to a circle of people that have substance use disorders. And I was a pharmacist sitting there, and they basically went through all their experiences, life experiences, being a patient in a pharmacy. And I was tarred with that same brush. And I kind of mentioned that. So that trust isn't there just because I'm wearing the white coat. Whatever experience they've had with a prior pharmacist, it reflects on everybody else. And so we have to understand that using that opportunity for me was to be able to get in the peer network, start talking to them, and I had more patients and more conversations, and it developed into a very warm, open, honest, and everybody's kind of, back and forth, kind of a nice conversation. So let me know where I can help you with that. Again, it's hard to kind of have the conversation directly because you don't know where that patient's been, what type of trauma they're going to in that moment. So we want to focus on trauma-informed care, stigma, that stigma language that we talked about, that destigmatizing language, and then go from that kind of, and just kind of build those building blocks up.
Great, thank you. And then I think our last question here, would you consider the term drug paraphernalia stigmatizing? And if so, what could be an alternate term for that? Thank you.
Yeah, so drug paraphernalia, that's a very interesting word. I've worked in different settings where, yeah, I would say we would probably refrain from that. And I'm very much like, are the supplies that you're using in order for you to be able to take your, that dose, are they clean? Are they safe? Instead of drug paraphernalia. That word, I haven't seen it too much, so I appreciate you bringing that up because I haven't seen that word used in quite some time, because it's more like, oh, do you have enough supplies? Like I call it basically like, do you have enough supplies to be able to use safely? So do you have safe supplies for utilizing your products, and have your products been tested in order for us to determine whether or not that they're tainted in terms of, are they safe to use? So the paraphernalia word, yeah, I think it does have a little bit of a negative connotation. However, I haven't seen it for a bit, but I do appreciate you bringing that question about. But I would say, do you have safe, supplies in order for you to be able to use safely? So and then go from there, and then obviously make sure that they understand all the different aspects of what they're doing and what they're using and stuff like that too, if you can educate them on that.
Great. Well, those are all the questions that I see coming through. So thank you so much to everyone who submitted, who stuck around, and who attended today. And thank you so much, Raheem, for this wonderful presentation. I just want to let folks know that if you want to keep up to date on upcoming webinars, we have a few that we're going to be planning for the new year. You can please feel free to sign up for our newsletter. We call it a special interest group. And I'll just post that in the chat. And then also, if you could fill out our post-webinar survey, we would really appreciate that as well. So I'll also post that in the chat for folks. And with that, I will again say thank you so much for joining us, and hope you all have a great afternoon.
Right. Thank you so much for the opportunity, and we'll see you again, I'm sure. Bye now.
Bye.